The reason we're all here today is that diabetes is a very, very prevalent disease. Right now it's estimated that there's about 20 million Americans with diabetes. It's estimated by the year 2030 that we're going to have close to 30 million Americans with diabetes. That's going to be 1/10 of the American population.
So how effectively can diabetic control reduce the incidence of complications? Pretty effectively. When you control your hemoglobin of A1C, you can drop your incidence of complications 60 or 70%. Some of you are sitting there and saying, but I don't just have diabetes. I have high blood pressure, and I have high cholesterol, and I have high triglycerides, and I have a low HDL cholesterol. And this is no accident. These conditions are genetically linked. So a diabetic individual is extremely prone to have the hypertension and the high cholesterol. These three things are highly connected. We want to get a feeling of how your blood sugars are at breakfast, at lunch, at dinner, and at bed. Now, some people say, I cannot test 4 times a day, and we understand that. We're compassionate. We're human. We'd love you to do that, but we understand it's difficult. So we ask to take a peek at different times. We ask to do a few in the morning, grab a couple before lunch one day, dinner another day, bed another day, and we call this staggering of the blood sugars. Don't wait for your doctor to analyze them every 2 or 3 months. Do this yourself. You'll learn where your good zones are and where your bad zones are.
Thank you for being here on World Diabetes Day. One of the most important things we teach my patients is how to test their blood sugars and when to test them. But I notice it's real hard for them to keep up with the ordering. Sometimes they do run out of supplies and they start testing their blood sugars. A lot of my patients like to work with medical companies like Lighthouse Medical, which keeps up with all the ordering for them. How does that work?
Well, thank you for allowing us to be here. We really appreciate it. It's really quite simple. What we do is when the patients call us, we get the order from the physician's office, make sure that we get all the medical history in order, and the insurance information, the billing information, etc. Then we ship a 3-month supply. The shipping is actually covered. It's a medical benefit under Medicare Part B. We ship them the supplies, 3-month supplies, and then we make sure that they get them. We check on them every 3 months to make sure that they have what they need.
Oh, so you do the ordering, bill Medicare, ship it straight to their home, and give them support?
Yes,
That's
exactly.
Great.
Exactly. It's very, very simple. In fact, our patients can't believe how simple it is. But they are covered on that, and there's always a live body to talk to, and then we work with the physician's office if there's any problems.
I've been giving lectures at this function for the past 10 years, and for the last 5 years, I would say, the information that I was giving was getting kind of repetitious because, frankly, in terms of curing diabetes or preventing diabetes, there wasn't a whole lot happening. And in the last year or two, I can say that there are some new things on the horizon that I think are very exciting, and that people who know people with diabetes type 1 or who have diabetes type 1, I think this is the kind of information that you may not get from CNBC, and I'm glad to be able to provide you with some additional insight today.
Behind me is Dr. Barry Horowitz, a graduate of the Columbia Presbyterian Fellowship Program. To my immediate right is Dr. Edna Tokea, a graduate of the Winthrop Hospital Fellowship Program. We have Dr. Sheetal Patel, a graduate of University of Pittsburgh, Dr. Gary Pepper, a graduate of the Mount Sinai Fellowship Program, Dr. Eric Cohn, a graduate of the Leahy Clinic Endocrine Program, and Dr. Sri Bantha, a graduate of the Brown University Program. I hope you have a great day at Palm Beach Diabetes and Endocrine Specialist Annual Diabetic Series. We will see you soon.
Palm Beach Diabetes believes that education is essential for all people with diabetes. That's why we developed an American Diabetes Association certified program to provide you with the information that you need to achieve and maintain good health. Our program discusses the basic medical issues of diabetes as well as the latest information on nutrition and exercise. So call the number on our screen to request more information about the comprehensive nutrition education program offered at Palm Beach Diabetes.